There seems to be a common word that we're using a lot in world-changing technologies here, and that's Utah. And you know, when we brought FiRe here 2 years ago, we have already started working on relationships with Utah through the Utah Task Force, Technology Task Force, through our friends. And this is really an amazing place that enables people to use technology to help the world. It's easier to do that here, and I'm going to talk with you about that more with the Hyperloop later, than most states. So I'm honored to be from Utah. I love a good story, and most of us do, and I have a really cool one. I met this beautiful woman named Katia Moritz, Dr. Katia Moritz. She is the clinical director of Neurobehavioral Institute in Florida. I met her at a birthday party. And I just thought, here's this power woman, and you know, and she's got it together. She's smart, she's funny. Like I want her to be my new BFF. You know, I want to hear about her work. And then somebody told me, they said, Katia found out that she's undiagnosed. And I said, what's it mean? And I said, can I get an introduction to Katia? And Katia said, I found out that I have something that is not diagnosed, that they can't fix me. I don't know if I'm going to be alive tomorrow. I have strange symptoms. You know, they try to put it in a basket called MS. I don't have any lesions on my brain. No one knows what's wrong with me. I have children. And I decided this is such an important issue. The more people I talk to, the more I realize how critical this issue is. So Sharon, I'm going to make a documentary. And of course, my FiRe Films cap came out, and I went, okay, how can I help you? So 3 years ago, we started saying, how can we help Katia make the film about undiagnosed medical refugees? And we held fundraisers, and we brought her to FiRe. We actually brought her to FiRe 3 years ago, and we put her on the FiRe Films panel. When she got off that panel, Vince Cerf, do you all know who Vince Cerf is? Co-founder of the internet, right? The real one. He came up to her and he said, you know, I have undiagnosed people in my family. 1/3 of that audience wanted to talk to Katia because they had undiagnosed relatives, and they realized what a huge problem it is, or undiagnosed children, and they don't know what to do for the children. So because of our network, I was at the SNS New York Predictions Dinner. Doug Jamison, a wonderful friend, amazing science brain. He's the chair of Harris & Harris Group, which invests in science. I told him about Katia, and I talked to him about undiagnosed. And he said, Sharon, I have family in Salt Lake. Here we go. And I said, when are you coming back? And he said, I'll be there in about 2 weeks. And I said, can you come to my house? Sure. So we had an open house meeting, and Katia met Doug, and we even have pictures of that first meeting. And from there, the story begins.
So good morning, everyone. We are here to talk a little bit about the Undiagnosed Disease Consortium, or what we call the UnDx Consortium today. And interesting, Sharon gave a little bit of the background of it. It was actually here at FiRe last year that Katia and I were talking a little bit more, inspired by the CTO challenge. And we said, why can't we take the work you've already done, work with Illumina, work with some others, and provide some contextual information around that, and would that help a patient population you're working with? And our thought was, over the next year, could we do this? And could we create this undiagnosed disease challenge? And could we actually get more answers for these undiagnosed disease patients? So today we're here to report back on that, and we're going to start with a small clip of the film, of Katia's film, and then we're going to move through some of the steps we took over the last year.
Without a diagnosis, these patients don't have any medical home. They don't have any support network.
We're alone in this journey. We really are like refugees.
It would be nice to have a place, even if it's a way away and you have to fly an airplane to get there like twice a year. It'd be nice to have a place where you could go and take your child and have them followed up on a consistent basis.
When we can't give them a proper label or a proper categorization, I think there is a unintended abandonment that happens.
We expect in our society that somehow we're going to find an answer and become diagnosed, so that when someone is undiagnosed, it raises the whole question of what happened to the system. Wasn't the system supposed to have an answer for me?
Even though we've been on this journey for almost 3 years, every opportunity for a test or another doctor to see, we're still kind of hopeful. But then again, the balloon pops when they you know, when there is nothing.
Hope is one of the most therapeutic elements. In fact, they call the NIH the National Institutes of Hope, and the Undiagnosed Diseases Program provides that for a whole cadre of individuals who have not had hope in the past.
We've seen 40 plus specialists across the country at all the best institutions, all the big names, and everyone kind of shrugged their shoulders. She said, she's a puzzle.
I was misdiagnosed for 27 months. He had gone from TIA to stroke to complex migraine to you're nuts.
I think that patients who have medically unexplained symptoms have a tendency to receive psychiatric diagnoses.
So you know what I would just love to tell doctors is it's okay if you don't know. And it's okay to admit that.
What you're asking me to do is to look for zebras. When you hear hooves, you look for horses. I had no idea what that meant. All I knew is that my child was lying in there dying. And my thought was he should be looking at everything.
What we really ought to be thinking, that diagnosis is co-produced by the physician and the patient.
He had to die of something. You're right. He had to die of something, and we don't know what it is.
What is so tragic is not only the human suffering, but also the fact that this population provides very important data that is not being stored anywhere.
The worst thing for me as a doctor is to have a child die and not know why.
I went over to her bed and I said, Gina, what's wrong? Mommy was very concerned. She called me. And she grabbed me by the collar and she pulled me real close and she said, Daddy, please don't lose me. And so I said, I won't.
You can't abandon your patients because you're abandoning them and abandoning their hope.
Thank you. So the UnDx So over the past year, the UnDx Consortium brought together 5 technology providers with a group that was brought together previously that Katia had brought together with a patient cohort that Katia had put together. And we hosted an event August 16th in San Diego where we had clinicians, experts in technology, experts biostatisticians that can interrogate that data to see if we could provide new hypotheses. Katia, can you just introduce us to your early work and all of the work that led to our conversation ahead of that as well?
Sure. I mean, what you guys saw is an early trailer of the movie. And at that time, we were trying to bring together the stories of the movie and give this population an identity. I had realized that there are millions of people who are undiagnosed, and nobody knew that they existed. And the medical system wasn't prepared to help them. And none of the data that was coming from this really important group of patients was being collected. And I thought, we need to do something about this. And I started making a movie. And when Geraldine was saying how hard it is to make a movie, I'm going to tell you something. There's nothing harder in this world than making a movie. It's extremely hard. And we decided that we weren't going to give up on it because we couldn't give up on our undiagnosed patients. When we started to tell their stories and go into their homes, it was the most heartwarming thing to see families living with the biggest uncertainty in the world, is having a family member who's sick. 2 of our patients are actually terminal, and they may die without a diagnosis. So we decided that, it's very beautiful to document that, but we couldn't do that. We had to figure out something we could do for those families. And the movie kind of became just what we were doing on the side, but we tried to advocate for them. So I got in touch with Dr. Isaac Kahane, who had become the principal investigator for the Undiagnosed Disease Network at Harvard. He, from the NIH, from the National Institutes of Health. And I wanted to learn how to put together some kind of a database. I'm not a computer scientist like you guys. And so I was like, how can we put together this information? And when he heard the story, he's like, we need to do something about this. This is an amazing story. I need to help you. And we decided that we were going to do a challenge called the Clarity Undiagnosed Challenge. It was a virtual challenge where teams from all over the world would come together and try to diagnose the patients in the movie, including myself. We needed genetic sequencing, so Illumina actually was a partner in this project, and we did the DNA sequencing, the whole genome sequencing for all the patients and their families. 26 teams from all over the world contribute to looking at this data. We created a new platform, a new way to look at information that we would like to replicate again, and then we got the results. And the results were really helpful because, first of all, it allows us to feel that we've done everything we could. We've gone everywhere. Everyone that mattered looked at our data, and we still didn't have 100% an answer. But we had a lead. We had some ideas. But what do we do with these ideas? We're like on the cutting edge of technology. We didn't know what to do next. We decided then to continue looking for answers for the families, because here we have this data, but where do you go next? And I don't know what a FIRE starter is some of the companies that come here. I don't know what we call the Undiagnosed Consortium, right? Because it is a FIRE starter that started here. So I was talking to Doug, and knowing that Doug knows a lot of people in the precision medicine world, and he's the nicest person, I said, Doug, what can we do? Who can we talk to that maybe could help us? And then Doug put us together with 5 amazing biotech companies, the nicest, the kindest people, and we set up a consortium where they would look at the data of the patients, right? And they would do testing, and there's a lot of stories about how we got that done. Complicated because it's not the system. We were going against everything that people think we should do in medicine. And then we actually put together the companies. So for the first time, all these companies that are totally separate in different areas of biotechnology collaborated. They shared their data, they helped each other, and they actually helped our patients. And the beauty of it is that we got more information from there than anywhere else. I personally have a possible lead on a diagnosis after 6 years having no leads at all. We learned a lot about things that we could possibly look for in the future. And now our movie really has a meaning to us, which is we actually, I always say there's an equation I had in my mind, which was that new technologies plus collaboration equals hope. And that is kind of what I was looking for. How can I put together all those people that have the new technologies and then bring them to help the patients without a diagnosis?
So let's come back. We'll come back to some of the results in a little bit. Let's kick off. So Ryan, can you just introduce yourself and talk a little bit about Illumina's involvement in this and sort of the catalyst, which to me was, with Katia, was one of the big catalysts of putting the UnDx consortium together.
My journey with the undiagnosed disease community started about 5 years ago when a friend of our family had a child who was undiagnosed, and we used whole genome sequencing to get him a diagnosis. So we sequenced all of the DNA in his genome and found what had made him ill, found a new disease in the process, and I completely changed the trajectory of my career. I was doing very basic science, and this got more applied. And Katia and I got connected a couple years ago, and we started talking about some of the cases that she was engaged with, and one of them we actually had a mutual connection through a little boy, Alex, who you actually saw in the trailer. And so we started talking about what else we could do together, and so Illumina, after much lobbying, decided to donate genomes for all of the patients that were getting followed in the documentary, about 5 families. And we have actually a clinical offering through Illumina for whole genomes, so you can actually get your whole genome tested clinically. And I think we're on the edge of a real inflection point, and I think that's reflected in the work that we're talking about here in 2 key ways. One is that most of these patients have been going anywhere from 5 to 8 years before getting a diagnosis, if they do. Many will never get a diagnosis. I work with a lot of kids with central nervous system disorders. 50% of those kids will never get a diagnosis. And we're now seeing work come out which is taking that to a completely new level. So some of these kids, where we went from 5% of the population getting a diagnosis, is now 50 or 55%. And that's because of the technology that Illumina's developed and a lot of the technologies you're going to hear about today. The other inflection point, which I think is represented by the UnDx initiative here, is that collaboration is required for us to be successful. we talk about tumor boards. You know, everybody gets around a room, all these clinicians get together and talk about the tumor and the right therapies for their patients. Same thing's happening with these undiagnosed patients and happening in these rooms. And now we're talking about expanding that to the whole community, getting the right companies involved, getting the right people involved, the right clinicians involved to get these individuals an answer. So we've been totally delighted to be part of this, and I think of the genome as like the foundation of the house, and then you got to put all the bricks and mortar and all that stuff on top of it.
So I think that's great. So so clearly the genome here was the substrate or the structure which we built on. John, can you just talk a little bit about what is the contextual information and why did we think the contextual information was interesting to bring together with the genomic information in the Undiagnosed Disease Consortium?
Right. Well, probably the best way I could start is just by, I've had my whole genome sequenced by Illumina, thankfully. And in my own results, I have 3.6 million mutations out of my 3 billion base pairs, and that's very normal. And of all those 3.6 million mutations, there was one mutation that actually had a medical association, and it was pretty minor. At my age, that's not unexpected because if I had a genetic disorder, I'd have known it by now. But that is the primary issue about why we've got to put other information on top of sequencing, because of those 3.6 million mutations, we don't know what the grade, 99.99%, we don't know what they do. And so you can build a certain model based on a genetic study in genomics, but you got to have other data to make sure that that's actually happening. And the other part of this is not every mutation, even in a disease gene, even a known allele that causes a disease, it doesn't cause the disease in every patient. And so, you need supporting information that says, no, I do actually have that disease, or I don't have that disease. And so, that's how we can hang other types of information.
That's great. Robin, can you take us through how we collected the data and what you and Origin did to make that all a reality?
Yeah, I sure can. So we interfaced with the 5 organizations to collect samples from these patients directly. We leveraged our phlebotomy arm of our business to go to these patients' homes. We showed up in their house with a centrifuge under our arm and a bag full of tubes. And we collected samples for 5 different purposes. One was for metabolomics, and we processed those samples immediately in those patients' kitchens, which was important for us to get that immediate separation of the samples. The second was for chromosomal rearrangement analysis. Third was for epigenetic analysis. Fourth was we also coordinated with dry ice suppliers to drop off a cooler of dry ice so that we can freeze daily microbiome swabs for 30 days for these patients. So that was a logistics challenge because the dry ice had to be refreshed every few days, and these patients had to store their little swabs in the dry ice. And then finally, for our IPS research, we collected a sample for ourselves as well. And that was fascinating. It was a really heartwarming project because these patients invited us into their homes. We got to see the patients and their family members, and we were able to collect samples for all of them and get these entire cohorts and a snapshot of these cohorts in a really interesting way. And it didn't go...
And everything went swimmingly, right?
It didn't go perfectly every time because, the little centrifuge has suction cups on it, and you stick the centrifuge on a really nice table in the kitchen because this is where you're going to do the work. And then you want to clean it up, so you spray some stuff to sterilize and clean it up, and you realize you've just removed the varnish on this nice piece of antique furniture. And you're like, oh God, So those things happen, right? So
we are also experts in table varnish now, where to get new kitchen tables.
Yep.
It's a small cost for good science.
And I know all of the dry ice ice cream suppliers around the country now because we made these calls. So that was an interesting project too.
That's great. That's great. So let's turn to the August 15th and 16th event. So we were able to collect the data. The 5 groups were able to analyze it. We were under a time constraint, so they didn't have a lot of time to present their data or speak before that. But then in San Diego, we presented the data on August 16th. So maybe in more of a group discussion, let's talk a little bit about what happened there. Maybe, John, you can start with some of the things we learned, but also some of the other experience.
Yeah, well, I think we do have promising results about a number of these patients, and so having promising results and actually knowing how to deal with the patient are 2 different things. And we've been talking a lot. I mean, last night we talked a lot on one particular patient, but So we are making findings. In the question, in a couple of the patients, we're making a lot of findings. And so a couple of these patients were extremely perturbed metabolically. And what that's going to allow us to do is at least propose treatments back. Now, we may be looking at symptoms of the disease or potentially maybe the cause, but we've got to figure this out. And one of the patients that wasn't in the original group, but we took another patient in that was a chronic fatigue patient, and we have had a lot of success in treating her. And so we know what is causing the chronic fatigue in the patient. We don't know how to fix it, but we know how to treat the symptoms. And so we've gotten her from being in bed and not being able to work anymore to actually functional, and now she just has these episodes occasionally and she can work through that. But now we've got to kind of work through with the physicians to test these hypotheses, right? So many of these things that we found are treatable. We have treatments that you could use, but now we've got to get through the attending physicians, and they have to agree that they're going to treat the patient. And so we're kind of at that stage right now.
That's great. Katia, do you want to talk a little bit about your experience?
Yeah, so I think, I tell people that if you want to walk in the shoes of an undiagnosed person, is just to remember when you're feeling really sick and you know something is wrong with you, and you go to the doctor and they tell you, it's 3 or 4 days or a week to get your results, and that time in between waiting for results, right? Where you know something is wrong, you're waiting, and imagine if that result never came, that you go for more and more and more tests, and you're sick, you're getting sicker, and you can't find the answer. And then you get to an edge where there's nothing else to do. You've gone everywhere, you've done everything, you exhausted what is available to you. And as an undiagnosed patient, the gratitude that we all felt for the companies for allowing us to even have a little hope and a path, right? The other part of it is you always want to look at the people coming after you. And so if we are suffering and we have an illness, so how can we educate the next generation? How can we help our children, our children's children, right? And what they allowed us to do is that, like Robin has immortalized our information, so then in 50 years, if we weren't able to find a diagnosis now, science will benefit from our suffering and our illness. And that's how we felt, going through this experience with the consortium, is that we were actually doing everything we could, not only for ourselves, but we were able to contribute to science. And we couldn't find a place for that before. So when a patient who's undiagnosed dies, the file dies with them because there was no repository for that data. There's no undiagnosed registry because we don't know what we have, right? And so I think that part of the outreach of the movie was exactly that. We needed to create a space, a place, a concept that will help people like us. And now we can help the ones that are behind us. And there's so many people. I mean, if I tell you what's going to happen when I walk outside, there's going to be people coming and saying, I have a son, I have a daughter, I have my wife, and I know a family member. And we want to be able to help these people. And I think now we have an outlet to be able to help them.
Ryan, Robin, anything else from the event?
Well, I mean, I think one of the discussions that came up was how do we do this for more people than the initial
Sure.
cohort that we collected, and I think that's a challenge in a lot of different ways. But I think it's a challenge that we are working right now to try to figure out. And I think that's the next step: is how do we get more people involved? How do we expand the pool of data? And how do we really scale some of the early kind of experimental steps and really scale that up?
Right, and I think the other thing is, how do we actually add more companies, right? Because now we have companies that look at different aspects, but there are companies out there that may have new technologies that could benefit, and that could benefit from what we are developing, right? So the UnDx Consortium is going to be a nonprofit organization that is going to try to put together companies, new biotech companies, that will assist patients to reach diagnosis. You guys have to realize that the medical system is really failing those patients, and they are struggling themselves. So we are actually helping the medical system. The hard thing is when we come to the doctors with all this precision medicine data, the doctors look at you like you're insane. I don't know how to look at this. I don't know how to read this stuff, right? So we are trying to develop this ability that the doctors, that we can actually merge the information, the clinical information that has been provided by the new technologies with the applications for the patients, right? Because if we don't have that, we haven't achieved anything. The data is unbelievably beautiful, But if it doesn't translate into some kind of treatment or moving forward in terms of diagnosis, it's not useful, right? So I think that what we'd love to hear is other companies that would be interested in looking at the consortium and joining the consortium, which was amazing, like the meeting, the energy. I mean, watching people collaborate, it was so intellectually stimulating, right? And very, very cutting edge. It was very out of the box kind of a thing. But we want to add more people, because the more technologies we put together and more collaboration we get, the more data points we'll have and more information we can provide in order to cross-reference and get some diagnosis and treatment.
That's right. Ryan, you said something very interesting earlier about the collaboration. I'm interested in your perspectives of what collaboration is coming out of the event the 16th, and what more do you see being necessary, and where does that collaboration need to come from?
Yeah, I think one of the best parts of that meeting for me was getting a lot of really smart people with different domain expertises together and having each other pressure test your hypotheses about these patients. Because it's really easy, just like these patients get isolated, it's easy to get isolated based on how you're seeing the patients. And that, I think the clinicians would admit that. I know I do. I see it through a genomics lens. And I think we all come at this from an angle. And so having a forum where we actually get together and say, wait a minute, that doesn't make sense to me. Why are you thinking about it that way? Was incredibly powerful. So continuing to kind of foster avenues to have those dialogues openly, transparently, I think is incredibly important. The other thing I just, in terms of that collaborative aspect, one of the things I think we've seen here is that in a very real way, this is patient-powered. And I mean, I think this is powered from Katia, but it's also powered from the other engaged patients that are all followed as part of this process. And we're seeing that more and more throughout the community, that this is a dialogue, that they play an active role in helping us define, derive, and go after the right diagnoses and the right therapeutic interventions. And I can think of a dozen examples off the top of my head where we wouldn't have gotten an answer if the parents hadn't been involved. And in fact, many of these parents of these children end up being better experts than most of the experts in the field. They are the most incentivized people in the world to know about this condition. And so I think it's not only about these companies, it's about the broader connection to the patient base that will allow this to continue to grow.
Katia, and it's going to be short, but Ryan brought us back to the patients. I want to bring it back to the patients in 30, 45 seconds. Can you just describe some of the patients that you've been working with that were part of this consortium that were willing to participate quickly?
Yeah, it is a privilege that they have allowed us in their homes, and now I feel they're like part of our family, and that's something undiagnosed patients don't have. They don't have a community, they don't have support groups. Now we do have some support groups, but they didn't have support groups when we started. And I think that the ability to go into their homes and watch their everydays and film their everyday lives, you know, just imagine having your child presenting with very, very life-threatening symptoms, and you have no idea why and what to do. All your decisions are based on, you're guessing, and usually your doctors don't know what to do, so they say, what do you want to do? You become your own doctor. There's such a gap in terms of the care that those patients can get. And they were the most amazing people. My daughter said something really funny. We took all the patients here to Utah, and we had an undiagnosed camp where we had them ski and do all kinds of activities, all adaptive activities, right? And my daughter said, Mom, it is crazy that those people are always smiling. The parents are always happy. And my friends, they're always annoying, right? And I'm looking at her, and it's like, it's so true. They are so grateful. And we have Jeff Lowe, which was on the cover of Sports Illustrated. And he's one of the most famous mountain climbers in the world. And he's now confined to a wheelchair, and he has no diagnosis, right? So we see an athlete that is the most amazing, person, and literally now he can't communicate. He's on a trach. I mean, he's lost all his abilities, and he's still so positive, and he's still engaged. And we were so lucky because all the families wanted to participate. They wanted to get the information out. They wanted to help other families, and we really put together a community. Absolutely.
So there's actually a breakout session for the UnDx Consortium this afternoon. I think we'll take questions at that point in time. I think the other purpose of that is to talk about what's next. What do we do in 2017? How do we take what we're doing at FiRe now and transform that to the next step to the UnDx Consortium? I also wanted to, Mark and Sharon often give gifts, so can Mark and Sharon come up here for a second? We have a gift for them. So I want to note, to do something like this, it takes a tremendous amount of people. It takes a tremendous amount of people that can rally their own resources and everything like that as well. The SNS family has been fantastic to us. Everyone up here, this was pro bono. People volunteered their work. They volunteered their services to do this, to get the data, to get the results, to analyze it, to be at the conference. And so we wanted to say thank you to SNS for putting this together. This is a plaque with a picture of all the participants at the first UnDx Consortium in San Diego. And thank you.
Thank you. Thank you.
Thank you.